Hello, welcome to Patient Advocate Match. This is another installment of our YouTube videos where we're introducing our health care professional, our businesses and services that are listed in our directory. And today we are talking with, Today we're talking with Sheri Fairman, and she has her company, Dementia Care Solutions. And so first of all, I just want to welcome Sheri. And this is going to be her intro video to let everybody know what Sheri does and how she can help our clients and our customers. So Sheri, welcome. You want to tell us a little bit about you and your company?
Sure, absolutely. So I'm Sheri Fairman. I have a master's degree in social work, and I hold certifications through TIPA SNO's Positive Approach to Care as an independent trainer and an independent consultant. And I am now an independent contractor with TIPA SNO and on her Positive Approach to Care employee list. So wonderful things happening. I started this particular private practice, Dementia Care Solutions, after working for about 10 years with people with disabilities, the elderly, and their caregivers, and really honing in some skills specific to dementia and specific to dementia care. And there's some things that were kind of barriers for me in my employment that kept me from doing some of the things that I felt my community really needed. And so I decided to branch out and start my own private practice. Dementia Care Solutions, the home office is in Green Bay, Wisconsin, but I'll provide services to anybody, anywhere. I work with clients by phone, virtually, in person, with multiple family members, organizational staff, as well as individual care partners.
Awesome. Well, tell us a little bit about your services. I know you just gave us the general, but what I know we talked a little bit earlier about some things that you can do to help, like train caregivers and things like that. So maybe go into a little bit deeper about what you can do for both the healthcare companies and then also for individuals and families.
Sure. So I'm a dementia care consultant. So bottom line, I educate about dementia. I can answer questions about the disease and what might be happening in the brain that's causing some of these symptoms that we see in the people that we're caring for with dementia. I can help people with dementia earlier in the disease. Oftentimes they'll have questions about the disease itself, what's happening, what to expect as the disease progresses, and planning and getting connected to services and resources. Most of my clients, though, are care partners, whether it's family or friends, neighbors, or professionals like staff, home care agencies, hospitals, or facilities. And I can support throughout the disease. So whether it's to help get a better understanding of the reality of the person with dementia, because once we step into the person with dementia's experience, we can begin to meet their needs, which will reduce challenging situations that often occur. And so by creating concrete tools, communication strategies, and effective interventions, care partners will see a better relationship and a better quality of life for themselves and for their loved one with dementia. I also provide in-person coaching with the person with dementia. So as I help the care partner understand a little bit better of what's going on in their particular situation, I could go in the home with the person with dementia and apply some of these interventions, do some coaching and supporting in real time, which is really a great way to kind of connect what we've learned and applying it. I can work with facilities. So some facilities will use me as a community presenter and invite the community in, and we'll talk about a topic that the community is interested in. And I can also then provide workshops for the staff who work in those facilities. And it doesn't have to necessarily be a facility. It could be a hospital or a home care agency. But a lot of times the assisted living facilities are really interested in learning some good techniques for their community members. So I can do that workshops for the staff. And then what's unique to me is that I follow that up and provide coaching on staff, on the floor with them, and help them through those challenging situations and apply what we've talked about in the workshops. If you're catching on to my theme, it's like information is a really important piece. It's a foundation. But in order to create a new pattern of behavior, a new way of being, we have to practice it. And so I'm there to help support throughout the journey, practicing these techniques, making changes, making tweaks, what works, what doesn't work, why. All of those things are things I'm there to help with.
I know, I was just thinking, and what an amazing service that is all the way around. There's so many families and even, memory care units or assisted livings that are focused on memory care. I mean, oftentimes, they have a lot of turnaround or, it's those type of facilities. I mean, it's special care. I mean, it's special things that they need to learn and understand, because it's not the same as dealing with someone that does not have, some form of dementia. So I think that that's a great resource. So how did you make the shift? I mean, or how did you decide that it was dementia that you felt kind of that pull to want to provide services for?
Great question. I actually was more interested in care partners and found my niche with dementia almost by accident. Where I was working at the Aging and Disability Resource Center, I was working as an information and assistance specialist who works with people with developmental disabilities, intellectual disabilities, physical disabilities, the elderly, people with dementia. But a lot of the people we worked with were their care partners. And I was a care partner myself to my mother, who had COPD, emphysema, vascular dementia, and then she ultimately passed away of lung cancer. So it was the care partner piece that got me roped in. And then through my shift in my job at the ADRC to dementia care specialist, when I really started to hone in my niche of dementia care specific.
And it is so needed. Kudos. I think that, again, I think that it's just a great service. Shifting gears a little bit, what was it about our directory that kind of drew you to become a care partner, so to speak, in our directory to provide your services? Or what kind of piqued your interest with the directory?
That's a good question. It's really tricky for us providing services to find the care partners in the community. I was a care partner. I don't know how anybody could have found me to let me know about their services that they provide. And so I have this philosophy of taking stuff off the plate of care partners rather than requiring them to do more and more. And so I want to diversify where they can find me. It's already hard enough to know what you're going to be doing as a care partner, what the next steps are, and what services are out there. So we don't need to make it harder for them. You came to me at a great time when this can diversify the ways that care partners can find us. And then that's just less work they have to do. Somebody else is helping and doing it for them. I really thoroughly believe that when somebody gets a dementia diagnosis, it takes a village. And so we're all pieces of that puzzle. And so this database is a great example.
And I do appreciate that. And that's the whole goal and the philosophy is that, you're absolutely right. People, why should they have to struggle so much to try and find, these resources? And everybody's heard about, long-term care or assisted living or, but there's a lot of services out there that can make their lives easier, both the care partners as well as the patients or the clients, but they're not well known, say like your services, or we have, music therapy. We have a physical therapist who has a course in home safety. All of these things that we want to be able to bring, to our clients and to the consumers, and just try and make their lives as easy as possible, because those that are providing care, I mean, they're oftentimes have their own families, their own children, their jobs, their careers. And, it is truly a labor of love, and to try and make their life as easy as possible and help them for doing the remarkable work that they're doing. So I appreciate you being part of the directory. And as you said, it does take a village. And I think too, if we're going to change as many lives as we hope to, that it truly does take a village. Okay, so I think we talked about a little bit about who you serve. Is there anything you want to add as far as saying, like, what would be your ideal client or customer for your business?
So really my ideal customer or client is anybody who knows somebody with dementia or knows somebody who's taking care of somebody with dementia, which happens to be a lot of us, because nothing about dementia is common sense. It might feel like, natural, this is what I should do, but oftentimes the natural thing doesn't work out. And so I'm here to help educate and support and guide through that challenging situation, the whole journey. So my ideal client is anybody in the community, family members, neighbors. I'm actually working with some people who are neighbors to somebody with dementia. People who live out of town. I'm taking care of my mom. She lives in Green Bay and I live in Colorado. People who have family dynamics going on and they're not all on the same page. And so I'm very skilled in helping people navigate those family dynamics that pretty much everybody has. So individuals living in the community, informal supports, the supports that are not paid for their services, and then anybody who's getting paid for services, anybody who provides care for people with dementia, who provides services to care partners. So think not only the person with dementia, but think about counselors or therapists who are helping care partners navigate this challenging role. And that therapist may need to use my services to increase their knowledge about dementia, to be able to support their clients. So when I say a village, I'm not kidding. It really is everybody and anybody who's going to touch somebody with dementia or touch their care partner. And I utilize our community resources as part of the village, and they utilize my resources. There's no competition. We are all here to help people have the best quality of life. And so put your village together so that you can end up with that goal, that best quality of life.
Awesome. I couldn't agree with you more. All right, let's shift gears just a little bit. Sheri, tell us a little bit about Sheri. What do you like to do for fun? Who's Sheri when she's not working?
Sheri enjoys a glass of wine a couple days a week. I'm always having fun, so it's hard to think of what specific things that I do. Family and friends, relationships are the most important thing to me. So getting together with my children, my grandchildren, spending time with my husband, doing a good old bonfire in the backyard. I enjoy playing volleyball. I crochet. I also knit, but not very good. So I'm going to be working on that this fall. I play the violin, and I say that loosely because I've had a violin for a year and have taken some lessons, but I need to get better at that. So I love to travel and get out. I just came back from Canada, visiting my sister, but I think my favorite place to be is home.
Awesome. Last question, Sheri. So looking at your business, where do you see your business, or what does that look like in the next 5 years? How does that look to you?
Well, I'm hoping in the next 5 years that I'm going to be hiring some help. I'm actually thinking maybe in the next year or two that I might be able to get an administrative assistant on staff. And within 5 years, I sure love to hire a couple of dementia experts like myself, get them certified through the TIPA SNOW's Positive Approach to Care, and provide a high quality consultation service to the community and beyond. And whoever I hire may not live in Green Bay. It might be somebody in Iowa or wherever, just so that we can continue building this network, this spider web of support. And all I've ever wanted to do is to help people with dementia and their care partners have the best quality of life. So if I can do that in the next 5 years and start increasing my staff and expanding, that'd be perfect.
Awesome. So was there anything that we missed talking about? Is there anything in wrapping up? Do you have any closing thoughts or maybe some things that we just didn't get to that you'd like to share before we wrap up today?
Well, I've developed a new approach to dementia care. And so I'll be working on that. You can follow me on Facebook and LinkedIn and Instagram. And it's called the fish analogy, is maybe to be renamed someday. But that is my approach to dementia care, where we look at people with dementia like fish in water. The water is their reality. That's where they live. And they don't like to be pulled out of the water like a fish. And so as care partners, oftentimes we want to help people with dementia understand. We will reason and explain things to them and try to convince them. And that's the same as pulling the fish out of water. And so I take the perspective of keeping the fish in the water. And as care partners, we get in the water with them. And once we're in their reality, we can begin to understand what they're experiencing, what the unmet need is, and then we can actually approach them from there and avoid pulling them out of water. So I'm working on a whole concept of that. So that's the exciting new things that I've been working on.
I think that's a great analogy. I really do, because I think, that's absolutely correct. And that's something that people can understand. And I think, when you were just describing that, I could, as a nurse can envision that, because that's exactly how a lot of things go, is people are always trying to bring them back to where we see what our reality is. Again, pulling them out of the water, and that just makes things worse. I mean, it really does. It's so counterintuitive. And then, as you say, that just really, really hit, home to me. What a great description and analogy. So I think that you're going to be able to do a lot of things with that. I think that's wonderful.
Well, thank you so much. And thank you for including me on your database.
Oh, you're very welcome. We are very, very, very blessed and very fortunate to have you as a part of our network. And I think you have a lot of value, a lot of great things to share and to offer. So we're going to wrap this up with Sheri Fairman with Dementia Care Solutions. And I'll look forward to seeing this video on YouTube, and we will let you know when that's ready and when that's released. So take care.